district?
Because it benefits the entire community, because everyone deserves health care.
Been pushed around like a weather vane, just hanging on through a hurricane.
The Robertson family is in charge of raising the donations here because they have graciously took the responsibility. So we just have a few questions for Morgan and Taryn. So how did you come up with the name Robert?
Well, he's always hogging the food, and usually it'll have to be 3 in one bin, and then 1 in one bin because one doesn't get to eat that much.
Okay. And when did you guys wean Robert?
October 23rd.
Okay. And how much do you think he weighs?
About 800 pounds.
Oh, wow. Now we have some questions for Kathy Cooley.
Yeah, I'm Kathy Cooey, and I'm the Development Officer with the High River District Healthcare Foundation.
Okay, so the Longview 4-H Leaf Club has worked with the High River District Healthcare Foundation a couple of times in the past. Would you care to comment on how that went for the foundation?
You know what? It was incredible. The support from the 4-H group has been such an integral part of what we do at the foundation. Things like the Charity Calf we call a third-party fundraiser, and that's when an outside organization or club raises funds for our foundation, and we're fortunate enough to receive those funds. So when we look at what the 4-H has done in particular, the last 2 times alone has been over $30,000. So that's a huge impact on what your club has done. And the first time it was for our teen health clinic, and that clinic sees over 500 youth from our community that use that clinic.
Wow.
And your funds help to purchase equipment to establish that. And the last time we did a project called Keeping Our OR Active, and those funds, which was over $21,000 you raised, went to help purchase equipment for our OR. So that was a pretty big chunk of what we were trying to raise.
That's good. We're glad we're helping. And are there any areas you would like to target with the funds raised by the club this year?
You know what, we after talking with some of your members and leaders, our thought was that maybe the emergency department would be a good idea. Lots of your members have probably used the emergency department or know someone who has.
Yeah.
And so our hope is there. You know, we're in the middle of an agriculture community, farming and ranching community. We're located near a major highway. There's lots of serious accidents. We have a secure STARS landing pad, and so lots of people are brought here, stabilized, and transferred to larger trauma centers. So we have a very busy emergency department. We have over 18,000 people who visit that department in a year. So yeah, it is pretty significant. And our hope was that one of the pieces of equipment we might be able to buy with the funds from the Charity Calf is a slit lamp. And a slit lamp is used to check out eye injuries. And those don't happen a lot, but when they happen, they need to be checked quickly and properly.
So grassroots initiatives such as our 4-H Club, raising and selling a donation steer can see a benefit for the community that we live in, correct?
Absolutely. As I mentioned earlier, it just has such a huge impact, groups and service clubs like you that do this. When we look at 2012, the foundation received over $120,000 from groups like yours. And so that's a huge impact on what we do. Our foundation on average raises $500,000 a year. So that's a pretty big chunk of that amount. And actually our overall fundraising for 2012, we had an absolutely stellar year where we raised over $900,000 for our programs and services. So you know what, without the service clubs in the community, we wouldn't be able to do nearly what we do and be able to enhance healthcare.
Okay. And so I just really want to thank you so much for explaining to everyone what exactly we do, because I think some kids in the club or just in the community were not really sure what we're helping with or what exactly, so you really made it clear to us. So thank you so much for giving us your time and explaining all of that, and I'm just glad to meet you.
Excellent. Thank you, Jessica, and thank you to your club. You know what, we sure appreciate you getting involved in the foundation and helping us out with this program. It's a great program, and I always enjoy coming out and meeting the members. And you know, like we always say, our physicians and our staff don't want us to need our facility, but when they do, we want to be able to give you the best care we can. So.